Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to discuss controlling bacterial burden in chronic wounds, okay? Now, most chronic wounds have a bacterial burden or bioburden, okay? So we will discuss that, but first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started, guys. So bioburden in chronic wounds. So it can be a major contributor to inflammation, infection, and delayed wound healing. So when we think about that, what is a chronic wound? It's a wound that has not healed in that 90-day period. Okay, so that's why it can be a main contributing factor. A lot of times we get stuck in the inflammatory phase with chronic wounds that don't want to heal, okay, or infection. And for people with chronic wounds who are at high risk of getting chronic wounds to begin with, so say someone with diabetes, they may not even be able to feel this inflammatory pain, the febrile state that's included with the inflammation, infection, and delayed wound healing. You know, they may not feel that there's anything really going on there with the wound and it's just not healing. That's what puts them at even higher risk. Or a patient with an ischemic ulcer in, say, peripheral arterial disease, they may report the pain or the fever or the redness, but the perfusion isn't significant to produce the edema, so the swelling. So they may have one or two signs, but they don't have all the signs there, right? So that's where complications come in. That's where problems, it's hard to diagnose problems. Now, remember, anytime we're dealing with chronic wounds or really any wounds, we want to make sure that we're using timers, our wound bed preparation. If you haven't seen that video, I'll link it at the end for you to watch because it is a super important video while trying to treat a chronic wound. You have to know, and if you don't know at this point what timers is, you need to know. It's something you absolutely 100% need to know to treat chronic wounds. So check out that video. It'll be linked at the very end of this video, okay? So we're going to discuss each of the contributing factors to bioburden, okay? So our first one up is tissue. So the problem, non-viable tissue. Okay, it's a problem. It's a breeding ground for bacteria, okay? Slough necrotic tissue. It needs to be removed so we can treat the actual wound. We don't want to treat a scab. We don't want to treat unviable tissue. We want to treat good, healthy tissue and allow that to grow. So first we have to get rid of the non-viable tissue. Now, I do want to state with that, if we have stable necrotic tissue caused by lack of blood flow to that area, we do not want to be debriding this. Okay, please do not debride in when we don't have proper blood flow, okay? If we get down too deep, the wound will just continue to get larger and larger then, okay? Necrotic tissue in that case will do better than actually getting rid of it. So that's the only case. But regardless, normally non-viable tissue, it needs to go, okay? If a person is able to heal, it needs to go. So what's our solution? Debride non-viable tissue. We need to optimize nutrition, okay? Our skin is our biggest organ. We need to be optimizing nutrition for our organs, right? For our body, and our tissue is our biggest body. So optimized nutrition will help in the healing process. Now, if you have a viable wound base and it's just not progressing, you know, we might want to consider topical application of growth factors to boost that wound to start healing, okay? So, infection and inflammation. So, most wounds actually become chronic because they're stuck in that inflammatory phase. Okay. Now, this could be because of a lot of different factors. So, like immunosuppression, malnutrition, comorbidities, bacterial burden, even topical therapies that are being used. Sometimes we don't ever notice if somebody's having a little bit of a reaction to a topical that we're using. So we got to be super careful with what we're using and only using antimicrobials if a wound is clinically infected or we have reasoning to be using it. Okay. So what's the solution to infection and inflammation? So we're going to use topical therapies, anti-inflammatory drugs, topical antimicrobials. And if you see you start using one and you notice that all of a sudden it looks more inflamed, stop using it. Go on to a different antimicrobial. There's a ton. You can find another one. Obtain a wound culture. This is so important, and I don't see it enough. Okay, not at all. I don't see it enough at all. Obtaining a wound culture. How do we know what we're treating if we're not obtaining a culture? What kind of bacteria is it? What are we going to be using on that wound that's appropriate? Okay, we don't need to just throw antibiotics at people because they have a wound, and it's like, okay, but what if this doesn't ever work against the bacteria that we're trying to fight here? And then that's when bacteria, they start becoming resistant to certain antibiotics. Like, we can't be doing that. We need a culture and sensitivity to see what type of antibiotics is appropriate. So targeted antibiotic therapy. And sometimes we either treat it orally or intravenously, depending on how bad the infection is. Next, we have moisture. So excess moisture creates maceration. So maceration is when you get that white tissue outside of the wound because it's been so moist there, okay? Now, a lot of times we've seen this on our fingers after we've been swimming, okay? So our fingers get wrinkly and they get white. That's maceration. Now, what will that do to a wound? It will make it get larger. Okay, this is non-viable tissue maceration. So we want to prevent this from happening because we don't want that wound to get bigger. Okay, so what are we going to do? Moisture solutions. If we have a too moist of environment, make sure that we're using specialty absorption. Okay, there is cover dressings that have that diaper technology that just suck up very well, but it also leaves the wound base moist like our eyeball, just how we want it. Okay, so we have this technology, we need to be using it. Okay, that's for copious amounts. Now, if we have a dry wound, we do the opposite. We want to hydrate it. We have to have a moisture balanced wound. It's so important. I talk about this in so many of my videos because it is so important. It is such a huge aspect of wound healing is moisture balance. If we have a just moist wound, it will heal a wound 3 to 5 times faster, okay? And it also prevents infection. You wouldn't think that keeping something moist, but it also reduces the risk of infection on wounds, okay? So with moisture, how can we control even edema? So when we have edema, say in the legs, we have excess drainage coming from that. What can we do? Compression therapy, okay? Move that fluid back up and out. Negative pressure wound therapy. It sucks the fluid out so you don't have an excess amount of fluid just sitting there. Now, if there is a sharp increase in moisture, you need to be aware of this, okay? If it comes out of kind of nowhere, this is a sign of infection. And if you don't know your signs and symptoms of infection, please watch the video of Nerds and Stonies. Okay. I will link that somewhere, probably in the description. Check out that video, okay? Because you need to know signs and symptoms of infection, and a sharp increase in wound exudate is a sign of infection. So the edges of the wound, okay? So this is another very important part that we always have to address is the edges of the wound. We want healthy granulation. Now, there's this phenomenon that happens known as contact inhibition. Now, it's where cells go across, forming a bridge. So they go across and meet in the middle to form this bridge across the wound, okay? Healing the actual wound. Now, unfortunately, this process also occurs in wound edges when they become stalled or have undermining or are rolled, and it creates this cellular signal causing the body to think that the edges of the wound is closed, but migration occurs in a shelf-like formation instead of bridging across, okay, to get meat in the middle, okay? So it won't heal properly if the edges are not viable, okay, or if they are stalled. So a lot of times we do need to clean up the surgically the edges of a wound, kind of debride them a little bit to get it to start closing again. So as you see, bioburden can really create a lot of havoc in a wound, okay? So we want to prevent the bioburden, prevent wounds from getting stuck in an inflammatory phase so we don't have the chronic wound to begin with, okay? So that's what we want to do. We want to be using our time model, now known as timers. We want to use these models. We want to close a wound as quickly as possible to accelerate wound healing, okay? That's what we want, is to, our goal of wound healing is to get that wound closed. We want to close it as quickly as possible. And the sooner we get a wound to close, the less amount of complications. So I hope this video did give you a better understanding, and you can use it in your daily practice. But that is all I have for now, and I hope to catch you in my next video. Bye for now.